Hello, I am Carolyn Graham from Virginia Commonwealth University at the Center for Rehabilitation Science and Engineering. And this is Mike West, my colleague at the Virginia Commonwealth University Rehabilitation Research and Training Center. We are both part of KTER, which is funded through NIDER. It's a knowledge translation grant. And we conducted a systematic review titled Review of Vocational Rehabilitation Interventions for Working-Aged Adults with Traumatic Brain Injury, Results and Implications, that was funded by NIDER. I'm going to discuss a little bit about what we found and describe the two interventions that were effective. And then Mike is going to join me in discussing it more further in more detail. The goal of the study was to determine the best evidence-based practices for vocational rehabilitation for adults with traumatic brain injury. And what we did is we examined vocational interventions that had been systematically evaluated and had been published or presented or were in some type of white paper. So we looked all across the globe and came up with over 700,000 articles. And we whittled it down to 368 that we reviewed. And of that, only 2 were found to be rigorous and were effective. And the 2 were holistic residential and supportive employment. And of these 2, they both use different populations. And I think this is real important, Mike. Because a holistic residential used a military sample and supportive employment used a civilian sample. And because there was no civilian sample that had research on holistic residential, we can't say that it works for civilians. And because the supportive employment was only on civilians, we can't really say that it works for military populations. First, I will go through the holistic residential. It was an active military sample, and it occurred at a minimum care military hospital on a military base. And it was because there was a lack of military barracks for the participants to stay in. And it was for those with moderately closed traumatic brain injury. And again, there has been no research conducted on civilian populations that use this. And again, it's very situated in a very military type context, which may have impacted the results. It was an 8-week standardized in-hospital interdisciplinary cognitive rehabilitation, similar to Prigitano's Malou-oriented approach. But it was modified to fit a military framework that could be done, and I'll talk about that in just a minute. But they did say that this could be modified for an outpatient setting. It included a number of different individual and group therapies: cognitive skills, speech, pragmatic speech, occupational therapy, coping, Malou, which focused a lot on neuropsychological, and psychotherapy and community re-entering outings. The unique component of this was the use of both individual and group cognitive therapy. Most studies that have used cognitive therapy with adults with traumatic brain injury have only used either the individual or the group and not the combination. And they felt like this was a unique and important aspect to their intervention. Now, these groups, the cognitive skill groups and the other group therapy, such as the speech therapy, were ran in classrooms, and they were ran in military style. So these active military folks who were in this treatment, also it was set in the military environment that they were very comfortable with. The cognitive components of the group therapy were orientation, attention, memory, visual processing, language, executive functioning, abstract reasoning, and problem solving. Then they had a planning and organization group therapy. And these were used, this group was used to address the executive functioning components that they found were greatly needed in these folks. In these, they addressed the setting goals, the planning, organization, initiating, monitoring, completing tests, and time management. In the Malou therapy, they address daily activities, and they discuss any type of actions by the patients or staff that could inhibit the patient's growing and developing independence. And so they would gently and directly communicate any types of situations and correct those situations so that the patients would be experiencing situations in which they could develop independence. And for any type of success or achievement or goal attainment that they had during the day, the patients would receive positive feedback for. They also found out that these active military adults with traumatic brain injury also had a lot of speech issues and pragmatic speech issues. And so they set up a group therapy for it as well. And they addressed nonverbal communication, initiation of conversation, turn taking, staying on topic, asking for clarification, revising communication to clarify when someone didn't understand what they were saying, verbosity, verbal organization, and social linguistic sensitivity. Then there was a work-based treatment intervention, and this was based on Ben-Yishay and Burke's work. And every day it incorporated hours of goal-oriented employment type tasks into the therapy schedule. The active military adults with TBI had a military routine, and this military routine focused on conforming to the military standards. And part of that was having free time in the late afternoon and the evenings. It also included the physical fitness training that all military are required to do. It also included scheduling their study and homework and living environments in a very military-oriented context. So it kept the structure that they were comfortable with. And they were also encouraged to wear their military uniforms. The staff who conducted the intervention included a physiatrist, a neurologist, a neuropsychologist, occupational therapist, speech pathologist, and 2 rehabilitation assistants. And sometimes when it was in certain situations, a physical therapist was called to help with the physical fitness training due to comorbid disabilities. Now, the other intervention is supportive employment that we found that was effective. And this was with a civilian population, and there was a number of studies, Elred and Moore, Wayman, and others. And the basic components of it were the supportive employment was a ecological analysis of potential work environments, assessment of clients' abilities and limitations, a client working with a job specialist or a job coach, and job site training, integrated work setting, and then a fading of the job coach or specialist. The employment specialists had a great deal to do in helping these folks with traumatic brain injury find a job and maintain that employment. They determined work preferences, determined how the employment would impact their financial situation or any benefits they had, determine any client expectations, would have to restructure work environment at times, arrange for assistive technology when needed, develop compensatory strategies for the client to use, and adapt to and help the client adapt to the work environment. And that is the basic portions of the supportive employment. And I want to ask Mike here some questions. He's an expert in supportive employment and has worked in employment with people with disabilities for a number of years. Mike, when you think about the holistic residential and the supportive employment programs, what is the feasibility of each of these programs?
Well, as far as the holistic residential program, I think it's important to note that, as you said, these are active military personnel, which means that they are more likely to be very recent injuries. And as a recent injury, they're much more amenable to improvement, because there is a healing process after an injury that lasts for 6 months to a year before the individual will plateau, and this is about as good as they're going to recover physically, cognitively, and so forth. With the support employment model, these are people that have already been through rehabilitation, and their symptoms and their problems are, they're adaptable, but they're not going to be curable, all right? Because they've already, and they could be months or even years post-injury. So the people that are going to come into community rehabilitation programs are, they've already gotten these types of services. Okay.
So how effective is supportive employment with individuals with traumatic brain injuries? Because these are long-lasting traumatic brain injuries. Can you talk about how effective it is?
Sure. Just to start with a little bit of history. Our center, the RRTC, began, we're one of the early architects of the support employment model, dating back to the late 70s, early 80s, and working primarily with transition age youth and young adults with intellectual disabilities, mental retardation primarily, okay? And that's how we learned and developed the model, and that was the first testing. In 1987, when I came to the center, we made formed a collaboration with the brain injury unit at the Medical College of Virginia to try this model with some of their former patients who had moderate to severe brain injuries. That's defined in a number of different ways, but basically what it means is there's going to be long-lasting issues and problems with them. We've done a number of studies over the years about the effectiveness of the model with this group, and largely very positive. They're not very rigorous studies. They're mostly like pre and post tests, but we have been able to improve people's employment outcomes using the model, before the service and after the service, and in a lot of cases actually bring them back almost to the point of where they were working when they had their injury, which is an important aspect of the program. Okay, one of the issues that we ran into early is that we did not know the population. And one of the issues that we ran up against is that in comparison to the individuals we had been working with before, this group has, they could have a myriad of problems. And you mentioned many of them, the cognitive problems and physical problems, but many of them also have social problems. They may have emotional problems or behavioral problems, such as a loss of inhibitions, all right, or volatility, and all of those issues they're more challenging for us as support employment providers. And the other difference that we have is that we are collaborating a lot more with the medical field. Yes. You mentioned physiatrists and the neuro rehab people. and with general practitioners and therapists, rehabilitation therapists. So it's a much more complex process, I think, than what we had been engaging in before.
Okay. So pretty much in supportive employment, they're getting a lot of what the residential holistic is getting previously and different.
And ongoing as well, because most of our clients did continue to see, the people in the brain injury unit at MCV.
What are some of the support needs and strategies for individuals with traumatic brain injury to be successful in employment?
Okay. Well, a lot of the support needs that they experience are the same as any other person with disabilities. They need job accommodations. They need an effective employment specialist or job coach who is going to be their advocate in the workplace and outside of the workplace. Oftentimes they will need supportive work environments. But there are a few things that are not unique, but things that they will need more than other people. And the first is cognitive rehabilitation. And this can include games and activities that improve their memory and concentration. It can also be what are called compensatory strategies, like using an agenda that they carry around with them. And it can be a written agenda, or it could be an electronic device, a smartphone that gives them reminders of what to do when on the job. Another area of cognitive rehabilitation that is becoming increasingly used is based on neurofeedback. And it's the specifics of it are beyond me. But using EEGs, brainwave activity can be monitored, and there are good patterns of brain activity and there are bad patterns of brain activity. And using the EEG and a biofeedback mechanism, people can be trained to train their brains to stay in the positive brain wave activity, and that helps them concentrate better. It helps them remember things better, and also has been shown in some cases to reduce problem behaviors that I mentioned before. Okay. Another thing. Support need that they will have is ongoing medical management. A lot of these folks will have continuing medical problems with chronic headaches, dizziness, fatigue, and similar types of things. And so ongoing medical intervention is often required, because these are problems that will keep people out of the workplace or make working very difficult for them. And so some of those ongoing medical needs might include PT, medications for pain, heat and cold therapies, ultrasound therapies, that sort of thing. There's also a class of medications called neurostimulants, which are chemicals that will stimulate the brain and promote more healing and better cognition, and that can be prescribed by a physician.
Well, what lessons have been learned from serving individuals with traumatic brain injury and supportive employment?
Yeah, well, we've been serving this population since 1987, so we have a long history with them. And we did make some mistakes in the beginning. It was a steep learning curve for them, but we have learned some lessons over the years, and I'll go over them briefly. Okay. One of the first lesson that we found is that we were more effective if we focused less on finding people jobs and more on creating jobs for people. Okay. And by creating jobs, it's going into a workplace and carving out a job. That's one of the phrases that's used often, is pulling tasks and responsibilities from a lot of people to create a new person, a new position. And what job carving does is it allows us to tailor the job for the individual's strengths and avoid some of the negative aspects of their injury. For example, if someone is known to have difficulties with volatility or with violating personal space, we can make sure that his or her job description doesn't include contact with customers. Right? Right? So that's basically how we go about creating jobs, you know, and for this population, we have found that the typical network of finding jobs, you know, going through the newspaper, want ads, and that, or job placement agencies, it just does not work very well because they just don't fit into the typical. They often do not. Don't want to say they never do, but they often need so many accommodations because of the multitude of their impairments and their other challenges. Okay. The second lesson that we learn is in the rehabilitation field, we tend to dichotomize the process as finding somebody a job and then keeping them in the job. Okay. And one of the lessons that we have learned is that you can't dichotomize it that much. Job retention begins in the job development phase because you're looking for a workplace that will be accepting of the individual, is flexible and willing to do the job carving and other accommodations that we talked about, and where the individual fit in socially. Okay. And sometimes it also means finding a workplace where there's a champion for people with brain injuries. You know, maybe, you know, somebody, a supervisor and an owner who has a history with brain injury, with family or friends who have brain injuries, or maybe is concerned about you know, the veterans with brain injuries. Right? And that person is going to be much more willing to do what it takes to keep this person in the job. Okay. One of the other things that we found is that it often takes multiple efforts to find people the right job. And we've been blessed over the years to have VR counselors working with us who are willing to do that for their folks. You know, we have had people that we have, you know, placed into 5 positions, 6 positions, because, you know, part of it is not finding the right job match. You know, but part of it is you know, the individual, you know, becoming dissatisfied with the job and that sort of thing. And what we also have found over the years is that you know, we did a study many years ago about our folks who had lost their jobs, which was a lot. And what we found was that that job loss wasn't really an event that happened. It was more of a process that took a long time to you know, to finish off, you know, and it was due to factors that kind of snowballed on one another. You know, a supervisor might say something about, you know, the individual's work quality or their speed. Right. They would become angry about it. They would start acting out more on the job, start being late, missing days. They would be reprimanded for that, and then it just things kept snowballing until finally either one or both of the employee or the employer just said that's enough. Right? And so what we found is that, you know, with proactive job coaching and interventions, you know, we can help alleviate that. But also it's also finding the right job that the person wants to do and can do in the long run. Okay. Finally, this is the last lesson learned. There's a tremendous amount of research out there about why some people with serious brain injury stay in jobs and others don't, or why they can find work and others don't. And these are called prediction studies, and they're usually based on a large sample of people, you know, 60 to 100 or more people who have attempted to go to work. And there have been a number of factors that have been found to be high risk, you know, like more serious injuries, higher age at injury, sex and race have also been identified as risk factors, and then educational levels. Right. And the important thing to remember, though, is that you can't generalize from these prediction studies to any individual, right? Because predictability doesn't mean predestined, right? The literature is also full of stories of people with very serious brain injuries, with very serious problems, who succeeded in the workplace, right? And it basically comes down to the right job, the right supports, and not giving up. on people.
Mm-hmm.
All right.
Thank you so much.
Oh,
for
you're very
sharing.
welcome.
We have our references on the back of our presentation. Mike, would you like to sort of wrap up what we learned today?
Okay. Well, we learned that there are, the literature provides us with two different methods of providing vocational rehabilitation services to people with serious brain injury that both seem to be effective. The holistic residential approach is largely based on the military population, and support employment is not. It's based on the average person with a brain injury that is looking for VR services. If you have any questions about anything that we've talked about, you will have the opportunity to ask questions using our web board, and we'll respond to them as quickly as possible. And we thank you for participating.
Thank you.